Hello, everyone. We have a debate today, a panel related to digital health and the future of healthcare. And we have a great global panel, which I'd like to invite Professor Soulla Louca, Director of the Institute of the Future, University of Nicosia, Cyprus. Maria Marenco, President of the Government Blockchain Association, Sweden. And Zaid Mahomedy, Head of Pre-Sales and Solutions Architect at the Chainstack, Singapore. Thank you for joining us for this debate and talk, which we're discussing the future of digital health and healthcare. And I'd like to mention some points which we are debating about, which is the focus that digital health is surely here to stay, and we are discussing the future with an aim of improving quality of life through technology and emphasizing how this can be possible. So I'd like to start with the panel, and you can introduce you briefly and tell us a bit about your job and your projects. Zaid?
Afternoon all. My name is Zaid Mahomedy. I'm the head of pre-sales and solution architecture at Chainstack. We're a blockchain infrastructure provider. We're a blockchain platform as a service, and we focus on consortium or permission blockchain development. And we work with a number of industries to implement use cases, including healthcare.
Maria?
Thank you. So my name is Maria Marenco. I am a healthcare informatician by training. I'm also a mental health professional, entrepreneur, and I am also involved in the Government Blockchain Association, chapter lead for Sweden Nordic, and also the e-health vertical for the Swedish Blockchain Association as well. And may I just say something?
Of course.
Now that we have the opportunity to be a little bit use the technology ourselves, I would like to encourage you to tweet, to post on Facebook, on LinkedIn, on this very great topic that we're going to talk about today, because this is something that is applicable for everyone. This is citizen health, so it's not patients or ill people. It's about your health, my health, and your health.
Great. Thanks, Maria. Soulla?
Thank you. Well, my name is Soulla Louca, and I come from the University of Nicosia in Cyprus. I have been in academia all my life in ICT, and taking into consideration all these different changes that we've seen in technologies the past few decades, definitely technologies, emerging technologies like blockchain, like AI, IoT, big data, will bring a lot of disruptions in our life, in all the industries, and of course, including the healthcare sector. And definitely their effect will be more profound if we consider them as being synergetic as well.
Thank you. So, Maria, I will ask you the first question. Okay. So, what is the state of play of digital health? Are all EU countries adopting digital health in the same way? What can we learn?
Ooh, what can we learn? We can learn a lot from each other. So I hope after this talk, we can encourage a cross-border collaboration, but also cross-industrial collaboration. So we can start with Sweden, which is obviously one of my home country. So in Sweden, we have said, and I know this is quite ambitious, so Sweden have come and said that we want to be the best in the world on digital health by 2025. So we're working hard on that. So obviously there is a strategy that we put in place. I think that by culture, we're quite digitalized. So everything that we do pretty much in the interaction of the citizen health, but also of public services is quite digital in Sweden. We have also said that we want to be cashless by 2020. So we will see how that will work. I'm also based in London. So this is also my second home country. With everything that's going on with Brexit. Of course, we can see that some of the technology might be of use when people are moving around and we want to have the data, and particularly the health data, traveling around with them as well. So that could be one other thing. The third thing will be, let's make this global, because I know you mentioned Europe, but I also have Latin American roots. So in Latin America, for example, we have a lot of rural areas, and we can see when we can use perhaps not high-tech, but also low-tech or more simplistic tech for the use of the citizens, where we can see that's definitely on the uprise, and the global market is taking a big rise.
Great. Soulla, so can you elaborate on the issue of collaboration when it comes to digital health and innovation?
Sure. When we look into digital health and innovation, definitely there is a lot of room here when we're looking into these different technologies to innovate. But at the same time, we should consider also the lack of skills right now in these different areas. Definitely, universities...
But you're mentioning skills, right? Today you're mentioning skills and the lack of skills.
Yes, the lack of
Today
skills.
we have a diversity of skills and technologies. Why do you think there is a lack of skills, particularly in digital health?
Well, even though universities are taking steps towards that direction to provide their students these necessary skills, let's not forget that even universities, they do have limited resources. And for example, having the right faculty to have the expertise to create the syllabi that is required, and to be able to transfer the knowledge, a type of knowledge that is changing continuously also, which means that this faculty, they have to keep updating themselves as well. And also at the same time, to enable them to provide what is actually needed, we need to take into consideration the collaboration of all the different stakeholders, that is industries, public sector, private sector, so that together they're going to design the correct curriculum and what is actually needed for these industries, to provide the right skills.
So surely to have a future in digital health, skills plays a key important part. But I will turn to you, knowing your experience and how you're practicing digital health in your own company, and the issues of regulating the digital health industry. What are your concerns and limit us from reaching the future, making it present?
Sure. So from our experience in this sort of industry, there are some standards or regulations. There's the HIPAA regulation, there's HL7 for messaging. But today, if you want to share patient records from one provider to the next in Australia, US, UK, it's via fax machine. We're still using fax machines today. How do we move to the next stage? So, we need to actually have like a regulation support, open sharing of information. But on the other flip side of it, the protection of information from a patient perspective is so important. So there's new technologies coming out, artificial intelligence, big data, word blockchain, with access to, personal medical information. You can do some great stuff, but me as a patient or a citizen, like my smartwatch or, my fitness band has got my health data. I don't want my medical provider, increasing my premium because I never sleep for 8 hours last night or walked 10,000 steps yesterday. How do we have a regulation that protects people? We don't.
So you feel that we need regulations to control the privacy, or when the information is shared, and you think this will be an enabler for future uptake for more people to participate in this digital health ecosystem?
So, the technology will allow any, amazing stuff, for predicting and forecast analysis. But, you can go a bit overboard with it. And you need regulation there to be able to protect citizens, to be able to control access to their data. I don't want a mandate from my insurance provider saying, you must share your information if you want to do business with us.
But this is interesting, and I will continue
I
discussing it. And here comes...
I think the problem is deeper than just regulation, because if we look, we've had different types of technologies over the past decades. How did we actually use them? Did we actually tap on these benefits that we were being provided? Why? What are the reasons why to just implement a simple electronic record system in a hospital? Because even within Europe, we see hospitals that do not even have an electronic record system, and we're still using paper-based systems.
This can be a concern. So education is broader than we can imagine. It's not just the skills you acquire to become professionals.
Exactly.
It is on the job, learning, updating, and getting people more on board. So here I need to ask this question. So we have been influenced when the internet was introduced and we get more information. Facebook allowed us to become more social. The mobile made us ubiquitous, pervasive, engaged all the time with technology. Blockchain is giving us the power to be more in control of our funds. Do we need something similar for digital health to be the future? What is your perspective about this? It's a challenge,
Well,
I know.
The tools are there, but it's up to us to actually tap on the benefits of these tools. I mean, even if there are challenges within the technology, these challenges can be solved. You know, researchers within universities, within various industries, and there are R&D departments, they're continuously working on solving these different types of challenges that we're faced with the technology. But when it comes to actually, you know, providing the right standards, we have so many different types of data that are in silos. So if we want to enable, for example, cross-border healthcare system across the borders, how are we going to do that? We just need, okay, in this case, regulation, standardization, to be able to provide this to society.
Of course, yes. But now it leads me off to a question, Maria. Blockchain, is it mature enough? Does it allow the digital community to invest in the digital health initiatives? What's your opinion from the experience you have with the blockchain?
I think I have an opinion on everything that has been said in the panel. So I want to start with the regulations. So yes, regulation is an issue. However, the issue is not that it's being highly regulated. One of the issues is that the regulatory is not moving as fast as technology. The second thing is the healthcare itself, without the technology, is a high regulated industry. And also there, if you want to decompose every layer, we're also looking at the different professions bringing their own ethical and regulated aspects into that. So it's quite huge. It doesn't make it difficult, because I don't want to disencourage the audience to jump into this ecosystem, because it's quite unique. But you need to be mindful about these things. And the other thing is also obviously culture. So yes, there's a lack of skills and everything. There's culture, anthropology. We talk about quality assurance as an entrepreneur, but are we talking about ethicality, ethical assurance? Because now, for example, there are clauses within the regulatory system, and there is a framework. We've seen it with the European Commission. We've seen it, you know, in this island. We've seen it in France, et cetera, regardless if it's AI, blockchain. However, the language that we use sometimes, even here, I think we can be a little bit ambiguous. What do we mean by definition when we say X, Y, Z?
Yes.
Right. So I think there's a lot of, not a lot, but there's still a little bit of space to be working there. So we have a good skeleton being placed in several parts of the world, but we're lacking about what we actually mean, because we are sitting here representing different professions. We have more on the technical side and development. We have academia. I'm a little bit of the hybrid of what's going on all yourself, you know, with research, etc. And if we put one word that we use in digital health, it will have a different meaning for you, for me, for you, and for the patient.
Yes. And do you think that, continue on this argument, but thinking of technology, what technology do we need? The technology that can help for us not only to have one success story within one country or with one institute, with one hospital or one environment to make this possible. Because we need all these key aspects which are essential, but technology's role, what is the technology which will make it happen?
There's no single technology. Okay. So, you know, DLT is one enabler. AI can help make sense of it and help with decision making. Big data, I think, is the most important. Clean, you know, quality data. You know, without the good data, there's no point in, you know, doing AI or any, you know, interesting analytics on that sort of data set. You need that. But how do you get that? You need some sort of standard so that people can communicate with each other. And, you know, for me, interoperability is a key thing that seems to be missing. Everybody seems to be developing solutions in silos right now.
But you were developing enterprise solutions.
Yes.
So you must face these challenges to be able to ensure that your products are not only available to the public, but they can interoperate with different ideas to make it happen. What are you doing to make this happen?
So we work with a lot of the open standards or the community edition protocols that are available out there. So like Ethereum, Hyperledger, Corda, community edition, that sort of thing. Common standards where there's an existing developer base who are already trained on that there, so you got the skills, and who are together working on industry use cases.
Thank you very much. So there are different approaches that we can take depending on the professionals. What's your point of view related to how professionals coming from different backgrounds would be on board to make digital health not the future but the present?
Actually, I was just going to say first one point related to what Zaid was saying. Sorry about that.
No, it's okay.
But when we're talking about data, let's not forget that we're talking about a patient's data, which means our data. What if we as patients had control over our data, empowering us to do whatever we wanted with that, and if we all work towards the common good to provide this data for the right purposes.
Yes.
So,
and
this is what DLTs are providing us. We are powering the patient.
And in the digital health, completeness of data is very key. It's not just that one entity or one person is participating, but this will require a lot of data, which is relevant, complete, and there so that we can use the AI tools. Basically, AI tools are successful with a right amount of data. And we know this, we apply it in different fields such as fintech and other fields where completeness of data and amount of data always give us better results. But going back to the question, what do you think? How can we get on board more professionals from different backgrounds? And this helps us get to an idea of how we can make the future.
I think the magic word here is collaboration.
Okay.
To bring all different stakeholders on board and maybe close them in a room and have them to talk actually to each other and decide on certain policies and what needs to be done.
Very good. So we're in the last 3 minutes, so I approximately 60 seconds each to give us some advice on the future and how can we get digital health more the future. Zaid.
So when you are designing solutions for healthcare industry for the future, the use cases are big. Don't try to develop everything on your own. There's many existing technologies, many existing skilled people out there. Collaborate with them. Develop open solutions where you can be the best at what you are, but tap into the skill or an API of a capability of another vendor. DLT technologies enable that, where you can protect your IP, but you can pay somebody else to access their service in a transparent, fair manner.
Thank you. Maria.
Yes, I'm going to be super quick. I'm looking at the time, but I want to encourage everybody who is here, who's not working in the healthcare sphere, and just to give you a little bit of a creativity, what can be going on. So we have a lot of people here from the e-game industry. So how can e-game come in and collaborate with healthcare? So we see this in mental health, creating digital space for example, children where they can learn mindfulness, they can learn going to therapy in a different ways. So that's, gamification, reward system, etc. That is one way. Then how can blockchain also with healthcare for people that just want to enter? There are blockchainers, as they call it, counterfeit medicine. We have billing management. We have the Internet of Things. How do we secure coming from the outside of the hospital world into the hospitals? Then we have agriculture actually working with healthcare. We have the holistic system, holistic healthcare. That's what we want. What do we eat? What can we learn from it? How can that be used for genomics, for example? And the collaboration that. So it's not necessarily just because you're a healthcare and I healthcare, and they're sure, we should play together. Everybody should look at it. And this is what is so wonderful, because there's a lot of space for creativity. And I know that, I can make this longer, but it's 1 minute and 30 seconds. Boom.
Thank you, Maria.
Thank you. Well, being in the city, I will only mention, some of the technological challenges. Yes, there are still quite a few technological challenges, like scalability issues with DLTs and interoperability, the cost to do this. But at the same time, you know, there is a lot of room for innovation, so one can just say, look into the synergies of the different technologies and how we can tap on this synergetic effect, disruptive effect that they are being provided to provide us with the different solutions.
Thank you very much. This was truly a global panel from different parts of the world, which their experience is broad in different countries. And thank you for listening to us and discussing digital health and the future. Keep in touch through Twitter or come and find us in our Faculty of ICT stand, where we can continue debating and seeing how digital health will be not the future, but become more of the present. Thank you. Thank you.
Thank you.